Dr. Poilan was born into a family which has passed on the knowledge and traditions of Ayurveda for many generations. He graduated from a world-renowned Ayurvedic college of Kerala, having international exposure. He is the chief physician at PVA Ayurvedic Hospital, which is located in Kantampally, Kannur, Kerala, in India. With over 30 years of experience with patients, he has a broad knowledge about Ayurvedic treatments and natural medicine, also for diseases and conditions that are caused by our modern lifestyle. Dr. Poilan has been spreading the word of Ayurveda internationally and gave speeches and lectures in 14 different countries.
My subject is management of stress, strain, anxiety of teenagers through Ayurveda. For the ease of better understanding, I make these two parts. One part is the basic introduction of teenage stage, the problem prevailing during this time, and the signs and symptoms. The second part is the management through Ayurveda and different aspects of Ayurveda in management of stress, tension and anxiety of teenagers. Teenage is a transition stage of human development physically and psychologically, and this is the period between 13 and 19. This is a crucial time of childhood. This is the stage between the childhood and adulthood. Here preparing the child to make the role of adulthood. Here the child feels that they are mature and ready to do everything, but the fact is reverse. Here the conflict starts. When we define the teenage, there are some aspects for defining the teenage. First is the biologically we can define, cognitively we can define, socially we can define. Here we can come to the part anxiety. Anxiety is a general term of several disorders that cause nervousness, fear, apprehension and worrying. Usually mild anxiety don't have much problem. When it becomes severe, it will be the problem for the day-to-day life. In everyone's life, everyone experiences the anxiety, but according to the condition of anxiety, whether we can decide whether it want to be treated or not. When the anxiety disturbs our daily routine life, example, our eating, our sleep, our speaking, then the need of treatment start. When we come to the anxiety, here I can define what is the anxiety, what are the different types of anxiety disorders, what are the causes and what are the symptoms. Anxiety is nothing but the feeling of comprehension or fear. The interesting feature of anxiety is usually the cause of anxiety always unknown. When we come to the division of anxiety or different types of anxiety, we can see some of the important types of anxieties. First one is a general anxiety disorders, GAD, panic disorders, phobia, social anxiety disorders, obsessive compulsive disorders, suppression anxiety disorders, post-traumatic disorders. Among these, generalized anxiety disorder is more problematic. In generalized anxiety disorders, this is a chronic and long-standing. Usually these people fear about the life, money, death, work, so many situations they will be afraid and it will be problematic for this type of disorders. Next one is the panic disorders. Also we can feel like this with a tremor, with a terror and apprehension that leads to shaking, confusion, dizziness, nausea and difficulty in breathing. When I come to the phobia, I hope each and everyone may experience this phobia in our life. Phobia is irrational fear and avoidance of an object or situation. Phobia is different from generalized anxiety disorders because phobia is a fear response identified with a specific cause. Example is agoraphobia occurs when we avoid the place or situation to avoid the anxiety or panic attack. Social anxiety disorder is the next one. Here we feel about ourselves, what other people says about us, how we present to others. Here also the big problem nowadays to the teenage groups. Some other anxiety disorders are obsessive compulsive disorders, suppression anxiety disorders, post-traumatic stress disorders. In obsessive compulsive disorders, we can see that they are doing the work and they go and repeat the work. Example, lock the door and switch off the light, they go and do the same thing. And suppression anxiety disorders also we can see when they separate from the family, when they separate from the school, we can see this disorders. Post-traumatic stress is also same, whether any unhealthy happiness happen in their future. Sometimes they feel that they are experiencing the same thing. This also cause anxiety problems. Then comes to the cause. We can see what are the cause of this anxiety. This is not a single cause. There are so many factors having the anxiety. The main causes are environmental factors, medical factors, substance abuse, genetics, brain chemistry, personality, and combination of any of these all together. In environmental factors, several types of anxiety includes trauma from events such as abuse, victimization, or the death of loved one. Stress in the personal relationship, marriage, friendship, and divorce. Stress at work, stress from school, stress from the peers. So many things we can see in environmental disorders. Next is the medical tension. That's all over the world now. When we take the medicine, we are worrying about the bad effect of the medicine, and due to the medicine itself, they get disease. There's a tension we are facing now all over the world. Next important thing is genetic. This is a very important one. This is a family to family, it is handovering. This is also very important part in the anxiety problems. Next is the brain chemistry. In the brain we can see so many hormonal changes are affecting. Here abnormal level of certain neurotransmitters in the brain are cause for the anxiety. This is the brain chemistry. This also cause anxiety disorders. Next one is the personality. We can see that personality developed from the womb of the mother. Here the low esteem and poor coping skill may be more prone for the stress. Now we can come to the symptoms of anxiety. Here also we can see so many symptoms. Here I am explaining only little more important symptoms. Twitching or trembling, muscle tension, headache, sweating, dry mouth, difficulty swallowing, abdominal pain. There's mostly we can see the child. When they go to the school, starting the school, we can see that the child having the problem of stomach problem. Some more symptoms we can see like this. We can see the dizziness, rapid or irregular heart rate, and rapid breathing, sometimes diarrhea, irritability, sleeping difficulty, and sexual problem we can see in such a cases. We can see the feeling of panic, fear, and uneasiness. And also we can see the repeated hand washing and cold and sweaty hands, palpitation, and inability to be still and calm, numbness. These are some symptoms we can see in anxiety. If you don't treat the anxiety, we can see the complication of anxiety. These are the main complications of anxiety: depression, trouble sleeping, that means insomnia, and digestive or bowel problems, headache, teeth grinding, bruxism, substance use disorders. These are the main complications we can see in anxiety disorders. Now we can go to the past stress. What is stress? Stress is a feeling of strain and pressure. Anything that make a challenge or threat to our well-being cause the stress. But we can't blame the stress. Sometimes stress leads to us a very good success, because there is according to the condition of stress. If it is more high, it will be problematic. It will affect your day-to-day life. But if the stress is less, we are ready to compete and we are ready to achieve the goal and we can reach the goal. The less quantity of stress is good for us to maintain our life, and to, mainly in this competitive world, it will be helpful for us. There are some interesting factors about the stress. When we see this, 80% of the employees suffer from work-related stress. 60% of all absenteeism is related with stress. 270,000 are off work of stress related illness in each day. This is a very interesting data about the stress. Stress is known to be a major cause of ill health, from mental, emotional disorders such as anxiety, depression, though to psychosomatic disorders or even major illness is due to the stress. We can see so many psychosomatic problems nowadays more increased. So, one among the main cause of this is the stress. Then we can come to the signs and symptoms of stress. We can divide this into 4 parts: cognitive, behavioral, emotional and psychological. What is cognitive? Decreased concentration, comprehension and memory is the cognitive stress. And behavioral, irritability, withdrawal and violence. Emotional, fear, anxiety, depression and fatigue. Psychological, increased blood pressure, heart rate, breathing, etc. And somatic symptoms, decreased immune response are the psychological signs and symptoms. Here in the stress, we can see the 2 types of adjustment or management of stress by coping and resilience. In coping, the patient have the ability to control the emotions and ability to perceive the reality, ability to think rationally, ability to solve the problems, and they can culturally define the problems. In resilience, they have the ability to bounce back, they have positive capacity to cope up with this and provide resistance to negative events. In resilience, they have more strong to avoid the stress. We can see that life is the balance between coping and stress. If the coping high or stress is less, no problem, but the stress is more high than coping, it will affect our normal life. We can now come to the point of the causes. Here also so many causes for having the stress. Main thing is the balance between the coping and the stress. If the person who can coping the stress effectively, he will be away from all the stress and tensions, and he can able to think rationally to solve the problems and place the stress in a proper context. When we come to the point coping, there are mainly 3 types of coping: adaptive coping, maladaptive coping and active coping. In active coping, the actively seeking resolution to the stress. That means we can avoid the stress completely from our mind. How can we identify the stress? Situations, activities and relationship that cause trauma to one's physical, emotional, psychological self is known as the stress. We can see wherever we are more tense or stressed, where we are getting more stress. Everyone knows that. When we go to the school, there is a stress from the school. After the school, we go to the job, there is a stress from the work. And when we are joined with the family, there is a stress from the family. And relationship, legal and the finance and health and environmental and moreover the living situation, these are all the main places where we are getting more stressed. As I told you, if the stress is little bit, it is good for our day-to-day life. We can see what happens when the stress is negatively affected. When stress affects negatively, we have physical and emotional stress. We can classify into physical and emotional. In physical condition, there will be the weight loss or weight gain, and unexpected hair loss, heart palpitation or heartbeat is more. We can see the high blood pressure also in physical conditions. We can see the emotional conditions. We can see the people have emotional condition, the mood swing, anxiety can lead to depression and unhealthy coping strategies we can see in the emotional conditions. We can see what happens when the stress continuing in our life. we can't neglect the stress because it is a major problem in our life. We can see which are the major problems. We can see the physical problems, emotional and mood problems such as depression, anxiety, eating disorders, any problems with the mood and coping. So we want to take care of the stress if it is affect our routine life. The last subject is the depression. We can see what is depression and symptoms of depression, types of depression and cause of depression. Depression is whole body illness involving your body, mind and thoughts. It affects the way you eat and sleep, the way you feel and about yourself and the way you think about other things. This is the definition of depression. Here also some facts we can see that recent survey says 1 in 5 teens suffers from clinical depression. Each year almost 5,000 young people in the age between 15 and 24 commit suicide. Rate has been tripled since 1960. The third leading cause of death is adolescence and second leading cause of death among the college age. Mainly this indicates that the teenage and adulthood the very problematic period in our life. We can see what is depression. The feeling of helplessness, hopelessness and worthlessness are intense and unrelenting. What is the main difference between the sadness and depression? Depression is different from normal sadness by engulfing your day-to-day life, interfering with your ability to work, eat, sleep and have fun. We can come to the symptoms. Change in thinking, feeling, behavior and physical well-being. These are the main symptoms of depression. We can elaborate some symptoms like change in thinking. What are happening that change in thinking? They have very poor concentration and they can't take decisions. They are very poor in making decisions. Memory impairment we can see and pessimism. They have no interest to do work, anything. They are more pessimistic and their esteem is very poor and excessive guilt. They feel guilt themselves and they criticize themselves and they sometimes do the self-destruction and these are the major problems in the change in thinking stage. In changing feeling, here we can see they feel very sad but they can't find out any reason and they don't have any enjoyment if it gives enjoyment to others also. And they have lack of motivation, they simply sit somewhere, they don't do any work and they feel very apathetic and they feel slow down in all activities. These are the main changes in feelings. Also we can see some signs and symptoms in change in behavior. The social withdrawal, they will keep away from the society and we can feel the changes in the appetite and either eating more or they don't eat nothing and they don't have sexual desire and they are away from the sexual activities. In the extreme, they neglect the basic hygiene also. That's why you can see change in the behavior. Next is a change in physical well-being. When we see the patient, there will be more fatigue, there will be sleeplessness, that means insomnia, and they have no appetite, they don't eat well, and they always complaining of pain and ache. When we come to the problem of teenagers, we can see the response of the female or boys and girls. In the case of females, they blame themselves, but in the case of boys, they blame others. Example, it is done by others, it is supported by others, like this, they will promote. But in the case of girls, they feel sad, apathetic and worthless. But in the case of boys, they are very angry and irritated and ego inflated. Some other things we can see that they feel anxious and scared in the case of female. In the case of boy, they create conflict and they feel suspicious and guarded. Mainly in the case, they will depend in the case of ladies or girls, they use food, friends and love for self-medication. But in the case of boys, they depend alcohol and TV and other sex-related things, they will depend to solve the problems. That's a very interesting, we can see the boys and girls, how they react with the depression. Then we can come to the cause. What are the causes for depression? There are main causes: the chemical imbalance in the brain, the family problems or family history, low self-esteem, environmental factors and individual factors are the main causes of depression we can see. Here also different types of depression we can see. The first one is a major depression, dysthymic disorders, psychotic disorders, seasonal affective disorders, bipolar depression.